New polling data shows COVID-19 vaccine hesitancy is increasing among Generation Z. This has health officials concerned because of COVID-19 case spikes among young adults. Fox Medical Team's Dr. Mike joins us to talk about what this means. Good morning, Dr. Mike. Good to see you.
Always a pleasure, Amanda.
Generation Z were born between 1997 and the year 2012. What are these polls showing exactly?
Well, basically, these are folks that are young enough that they've gotten a message that COVID-19 doesn't really affect them. And so many experts think that that might be part of the reason that they're hesitant to get vaccinated. The other issue is you hear these stories about Johnson & Johnson vaccine being paused and side effects. All of these things play in. The other thing that experts talk about is the fact that with young people, they tend to use other ways of communicating. They use social media, and maybe we've not done as good a job as we could regarding getting the message out. I can tell you, Amanda, the biggest group of people that are getting COVID-19 right now and ending up in the hospital are young people. So we have to do a better job at getting the word out.
On the younger end of Gen Z, we've got those born, 2012. My daughter was born in 2004. She's 16. She got her first dose because her mother and her father, my husband, went and signed her up to get a vaccine. She's part of Gen Z. As her parent, I have chosen to say you're going to get the vaccine because it's for the health of our family. So maybe on the younger end, they don't have a choice, but those that are above the age of 18, it is up to them to decide whether or not they want to get a vaccine.
Well, I believe in communication. And look, I have a 12-year-old and a 9-year-old. If I could get them vaccinated today, I would leave my office and go get them vaccinated because it's the only way we're going to get out of this mess. And when it comes to getting back to a normal existence with school and everything else, if you're vaccinated, the data shows you have very low risk of getting ill, a very low risk of being in the hospital, and low risk of transmitting the virus, Amanda. And so we really need to get our kids online, and we're waiting for the safety data. You just need to talk to them. And I think you're an awesome parent. And I would do this. I just told you, I'm planning on doing the same thing. If I had an older son or daughter, I would say, look, here is why I think you should get it. And not like I am being the know-it-all, but I would say, look at the data. Let's take a look. And these are smart kids now. The bottom line is they know what's going on. And I think if you treat them as adults and reason with the data, you're going to be successful.
Oh, you're absolutely right. My 15-year-old, he was asking me about the data. He says, well, Mom, I know it's okay for the 16-year-olds, but what about the younger kids, those that are 12, those that are 15? I said, we're getting the data in, Mikey. We're gonna read it. Here's what's going on. So you're right. The message is information.
Listen, you're a gold standard mom. I can tell. All right. And, with my kids, the other trick I have, when you're in therapy someday, I'm sure my name will come up. Just bring it up. Yeah. Along with all the other things.
Oh, you and I could talk about that. Oh, that's a whole other conversation, and we will have off the satellite, Dr. Mike, because I got some stories now that they're teenagers. In any case,
yeah, well,
we will end on that note. All right.
Yeah.
Have a good one, Dr. Mike. Take care.
You too, Amanda. Have a great day. Thank you so much.